Hello, my name is Charlotte Berry and I'm one of the clinical nurse specialists for the deteriorating patient. So this video is designed to teach you how to put on a high concentration reservoir mask, or a non-rebreath mask as it's also known. So these masks are designed to be used for acutely hypoxic patients with saturations of less than 85%. So they will deliver anywhere between 60 and 90% oxygen. So all clinical areas need to make sure they have at least one emergency oxygen cylinder available for use, and it needs to be ready with a non-rebreath mask attached. They also need to make sure you have the correct delivery adapter onto your flow meter so you can attach the non-rebreath mask onto it. So if you have a deteriorating patient with saturations of less than 85%, then you are going to choose your non-rebreath mask for this patient. So get it out of the bag, find the end of it and attach this onto your flow meter. You then need to turn it up to 15 litres of oxygen. The line on the flow meter at 15 litres needs to be going through the centre of the ball. Once the oxygen is flowing through, you then need to make sure that this bag here is inflated. If it's not inflated, then you need to do that yourself, and you do that by covering this valve here. Okay, so you just place two fingers over the top, and that will occlude the valve and it will fill this up with oxygen so that your patient has a reservoir of oxygen to breathe from. So once you've done that, it's now ready to put onto the patient. So place it onto the patient, make sure the elastic is underneath the patient's ears for comfort and to prevent sores above the ears, and then monitor the patient's oxygen saturations throughout. So this device is not to be used long term, and you should have immediate review by the doctor of your patient, and a plan of care needs to be put in place. So once the patient is stable and they're showing signs of improvement, and particularly in their oxygen saturations, they then can be transferred on the humidified oxygen device and titrated down. Thank you very much for listening to our video of how to put on a high concentration reservoir mask or non-rebreath mask. So in summary, use a reservoir non-rebreath mask for hypoxic patients with saturations of less than 85%, or use the non-rebreath mask if the patient is critically unwell and deteriorating rapidly in conditions such as shock, sepsis, major trauma, drowning, anaphylaxis, major pulmonary hemorrhage, status epilepticus, or major head injury. Do not wait for an oxygen prescription in an emergency situation. Inflate the bag before use and then use with 15 litres per minute of oxygen. Please make sure you familiarise yourself with where your nearest emergency oxygen cylinder is, where the non-rebreath mask is, and how to attach it onto the flow meter. Monitor the patient's pulse oximetry throughout, and then look to titrate the oxygen once the patient has improved. Any questions, please direct them to the deteriorating patient nurse specialists or the critical care outreach team. Thank you for listening.